Guatemala. Nestled in Central America between Mexico and Honduras. Our case study begins in the highlands of Guatemala, near the shores of Lake Atitlan, in the Mayan village of San Lucas de Tomas. Lake Atitlan is the primary source of water for the 30,000 indigenous Mayans in San Lucas. But the lake is contaminated, and drinking its water can be deadly. On December 27th, members of the Santa Cruz, Watsonville, Capitola Aptos, and Sunrise Peninsula Rotary Club teamed up with local Rotaract high school students and Cabrillo College engineering students to install a Sunspring water purification system at the Monsieur Gregory Schaefer Hospital. Although the hospital has running water, it's not safe to drink. To overcome this problem, they purchased bottled water for all surgical and hygiene needs. The Sunspring water system will create 20,000 liters of fresh, safe drinking water per day. The hospital will only need a fraction of that clean water and has committed to giving the excess safe drinking water to those in the San Lucas village that cannot afford to purchase clean bottled water. While it's too soon to measure the results of this project, we can predict that the access to safe, free drinking water will have a positive impact on the child mortality rate in the San Lucas de Tomas village. Obviously, there are many worthwhile projects that our club could embark on both here and abroad, but the subject of water purification is fast becoming one of the most relevant of our time. Here is the good news. 15 years ago, the World Health Organization reported that 4,000 children under the age of 5 die every day from waterborne illness. In a 2014 GLASS report, that estimate had decreased to 2,200 per day. Progress is being made. A recent article titled "The Global Diarrhea Burden," published by the CDC and based on research conducted by the World Health Organization and UNICEF, states that 88% of diarrhea-related deaths are caused by unsafe drinking water, coupled with inadequate sanitation and hygiene. While we have gained ground in recent years, most of that progress has been made in densely populated urban areas. Rural areas, such as the farm, towns, and villages that are home to hundreds of millions, have not seen improvement. Dr. Bruce Clemens, an internationally recognized water expert from Furman University, observes that while 70% of urban households in developing countries featured piped water within the household, only 25% of rural populations are so privileged. Clean water is something that we take for granted, yet in most of the world, it's a luxury that few can afford.
I've been in the water business for about 33 years now, and my background is operations, maintenance, and management of public drinking water systems, along with wastewater and industrial. About 7 years ago, it started with an email from a little girl in India, and it was 3 lines, and it said, "I drink water every day because I have to. It makes me sick." And my thought at that time was, why can't we get the same technology we use in the U.S. anywhere in the world?
One of the most important things to remember is that it's not the lack of water at the root of the issue. It is that most of the water is contaminated and simply unsafe to drink. Rotary over the last 30 years has worked to eradicate polio, a project once thought to be impossible. Yet now we are at a point where that goal is at a foreseeable end. There's a growing movement within the Rotary organization that is now setting its sights on water as the next challenge.
Rotary International's success over the last 25 years with the eradication of polio was thanks to a narrow focus as opposed to working on things like disease research and treatment. It was merely immunization out in the field. And the 1.2 million member army of Rotary was able to accomplish eradication around the world. And it's almost unthought of now. And that's what we want to do with the global water crisis. Instead of focusing on all things water, we're narrowly focused on water purification with H2 open doors. There's an abundant supply of contaminated water in the world, and that's what we focus on, and that's where we'll find success.
Simply put, we do not need to dig wells to create a water supply because the water is already there. So in many urban and rural areas, all that needs to be accomplished is the purification of existing source water. If you were to compare the water purification model to the polio vaccination model, they are almost identical. And that means that we have existing methods that can easily be repurposed to accomplish the water purification goals. Perhaps that's why Rotary International has recently established that clean water is one of its 6 areas of focus. If Rotary is going to take on water purification as it did with polio, then it needs a turnkey system that can meet the diversity needed to accomplish this goal. The Sunspring water purification system meets and exceeds those demands. The Sunspring system is a standalone water purification system that takes in contaminated water and outputs water comparable to bottled water. And it does it at the rate of 20,000 liters per day at virtually zero cost.
Well, realizing, the design aspects of the Sunspring, knowing the remote locations we're going to around the world that need the safe drinking water, there were 3 major factors. And one of them was that the water had to be absolutely safe to drink. Not just better, safer, cleaner, but has to be safe. And then after that, we had to make enough of it to make a difference. And so we designed the Sunspring to produce up to and exceeding 20,000 liters a day. That's a lot of water for a community. And then the third one was the ongoing maintenance cost of the Sunspring. Using the solar and wind power, once it's installed, there's no daily operating cost associated with a generator for gasoline or diesel fuels. So it basically runs cost-free.
There are some other advantages to the Sunspring system that make it attractive to Rotary clubs as a project. The Sunspring can be installed in about 4 hours. The installation is simple and does not require an expert. It consists of some basic plumbing. Once in operation, the lifespan of the unit is an estimated 10 years and only requires about a 90-minute maintenance schedule per month. The Sunspring has been tested in the most rigorous environments with over 250 units installed in 15 countries around the world. The excess water created by the Sunspring system can be sold by communities to create a revenue stream.
As for the maintenance of the systems and the longevity of them, they've exceeded our expectations. We put a field life of the Sunspring hybrid, we say it's 10 years because an estimate for the membrane life is 10 years. In the 7 years that they've been installed, we have had no membrane failures in the field and just routine maintenance. We haven't even replaced a battery yet. The Sunspring today, as opposed to 6 years ago, is about 40% more efficient than it was then.
The Sunspring is a highly technical solution with a very low maintenance overhead. It does, however, carry a $20,000 price tag. Some within your club may think that that's too much. However, when you consider the track record of the Sunspring, it becomes easy to see why Rotary International has endorsed the use of Sunspring water purification systems.
So Sunsprings is a perfect fit for the rural areas that are most in need of potable water that we're trying to target with these projects. It serves villages of about 5,000 people. It generates 20,000 liters of water a day. I think an incredibly important part of why we focused on this technology is that it's a very simple system, and so people can be trained very easily, a couple hours on the regular maintenance that it requires on a monthly basis. So it was a good fit of technology, not just clean water, but EPA standard clean water, the water that you and I would drink. The vetting was significant. Again, with Brad Howard's recommendation, we contacted the Water and Sanitation Rotary Action Group. WSRAG checked it out for us, and we had confirmation from them that this was appropriate technology.
While there were other water solutions available for this case study, we chose the SunSpring for its ease of installation, longevity, and most importantly, because it had been reviewed and approved by Rotary's Water and Sanitation Action Group. We recommend the SunSpring, not only for the ease of installation, lifespan, and longevity, but also because of the logistic experience in transporting your project into the country of choice. Rotary has had a profound impact around the world. In many of the locations you may choose for your project, there is likely to have been a Rotary group there before you. Many times, the communities that have been impacted by Rotary clubs in the past will identify your group as one and the same. You may be invited to attend celebrations as honored guests, and as we experienced in San Lucas de Tomas, you may be asked to meet with local officials to listen to requests for more contributions. It is important that you are aware of this possibility and that you have been educated on the proper way to address the situation. One of the ways to become aware of this possibility is to partner with a local organization. When possible, a local entity outside of the government, such as a church or other nonprofit-based organization, can help you organize and create an agenda for your group. If you have a member within your club with experience in traveling to that location, utilize that member's knowledge base.
Well, I've been involved in Rotary International projects for the last 20 years through Santa Cruz Rotary, and we've done a number of different projects in various parts of the world. When you are doing a trip planning for a group of this type, there are a lot of considerations. The first thing is, how stable is this country you're going to? The next part of the puzzle is to put the people together. All Rotary projects involve connections with other Rotary clubs in the host country, and that's to do our work. This is what we have to do. So you have to, if you're bringing in the water technology, when is that technology going to arrive? So you can connect that with the people involved, which are the local Rotary Club and certainly the civic leaders in the community that you're going to do the work.
When you're organizing 14 people for a trip, especially in a country where you don't speak the language, you've got to have a number of jobs. You've got to have translators, and we had 4 people that spoke fluent Spanish, so we had lots of depth. You've got to have somebody that has been to the location and has been on the ground. That was Dr. McKenzie. He had done multiple trips over 2.5 decades to Guatemala, was very familiar with the area. And so we not only had a great experience on the ground where we installed the system, but we had a multicultural experience throughout the 5 days where we were in San Lucas, we were in Panachel, we were in Antigua, and we were in Guatemala City. So they did a marvelous job of organizing that. You want to document the trip so that you can share it with the fellow club members. We had 4 youths with us, and so having a youth coordinator on board was very important. We had people that their job was just to be runners because we knew we were going to forget things. And had, like the flags for the presentation, which my wife was able to run after. We had Dr. Clemens, who was very critical to the success of the trip because he had been on the ground for almost 40 years. So there's a lot of different players in a team project like this, and it's really critical to have lots of backup.
The advantages to partnering with a local agency can give you valuable insight into the community and can better help you appreciate the culture of the people that you're there to serve. An example of this is the experience that we had in Guatemala. The mayor and other elected officials arranged for us to participate in several events while we were in San Lucas de Tomas. The first of these events started with a panel discussion where the mayor and leaders of the local water agency, Agua de Pleba, explained that some of the work that had been accomplished with water had been accomplished on the backs of officials who had been assassinated for their work. In their community, there were several undercurrents in regards to water, land, and the diversity of a multicultural community. While they were undoubtedly asking for new contributions, they were also communicating the actions that they had taken on their own behalf. Some of the actions involved the never-before-seen easements of landowners to facilitate the building of roads. Others involved the matching of donations from city officials for the purchase of materials in furtherance of the delivery of water to the poorest of the poor. In each of these events that we were invited to attend, there were valuable nuances communicated that might have been lost without the experience of partners from that location. If it is possible, seek out an experienced local organization familiar with the social and political environment in the location where your Rotary Club plans to travel. We don't yet know how many lives our project will impact in San Lucas de Tomas, but we do know that our enthusiasm for rural water purification projects is getting noticed. A recent letter from Rotary International's director Brad Howard recognizes that rural water purification and sanitation is one of Rotary International's highest priorities. It also goes on to state that the Water and Sanitation Action Group has endorsed the Sunspring as a solution to rural water purification. And finally, it commends and has endorsed the Guatemalan Water Purification Project as a unique and wonderful model for other clubs to emulate. We asked the question at the beginning of this program, why water? And the answer is simple, because Rotary has almost cured polio.